Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is going to bring curiosity, humor, and reflection to the world of palliative care. We're going to explore the joys and challenges of working in this incredible field, looking at topics from education to advocacy, self-care, and leadership. I'm one of your hosts, Dr. Megan Doherty, and today I'm at St. Jude's Children's Research Hospital in Memphis, Tennessee. I'm excited to be joined by Erin, a fellow Canadian. She's currently based in Nairobi, Kenya, and she is one of the St. Jude Global Palliative Care Scholars for 2023.
Erin, welcome to the podcast. It's so great to have you on the show. Would you like to introduce yourself so that our listeners know who you are?
Yeah, my name is Erin Das. I'm a palliative care nurse originally from Toronto, Ontario, Canada, and now I'm living in Nairobi, Kenya.
And you have brought a wealth of nursing experience to your work in Kenya. Where else have you worked before this?
Before we moved to Kenya, I had the chance to live in a country called Papua New Guinea in the Pacific. We were living there for about 3 years. And then before that in Bangladesh, I had a chance to work and live in Dhaka, Bangladesh.
Wow, so you've seen nursing practice all over the world. And today you're on the show, you're going to tell us a bit about a nursing leadership program that's been running for several years in Kenya. Can you tell me a bit about the program?
Yeah, when we moved to Kenya in 2019, I got a chance to meet some of the palliative care individuals that were working in Kenya, and I was really quite inspired by the work that they were doing. And since I had moved from Bangladesh and Papua New Guinea not too long before that, I was quite curious to see how nurses were involved in palliative care in Kenya.
And then you did start a program, and tell me about what the program is like. It runs for a couple of years, and how does it work?
A few years after I arrived in Kenya, we applied for a grant from a funder called Hospice Care Kenya, and we started the Nurse Leadership Initiative for Kenyan nurses. It was a one-year program that we got funding from Hospice Care Kenya, as well as a foundation from Canada, to enroll about 10 nurses in an intensive leadership program focusing on curriculum development to plan for workshops in their workplaces. And we're really encouraged by the interest in the program.
Amazing. And so you had these 10 nurses, and what kind of backgrounds were they coming from? What kind of nurses were they?
So all of the nurses that we enrolled into our leadership program had a chance to do a higher diploma in palliative care. In Kenya, we have access to Nairobi Hospice, which offers a higher diploma in palliative care, as well as a university in Uganda, which is not too far. So the nurses had either done one of these programs and had quite a passion for palliative care and promoting it in their workplaces.
Amazing. And then I heard you paired them up with some nurse mentors. What was the role of the nurse mentor?
The history of palliative care in Kenya is quite strong, and it is led mostly by nurses. So we have a lot of nonprofit hospices across our country, and oftentimes they are led and kind of headed by a nurse. So the history and the strength of the palliative care nurse in Kenya is quite strong, and many of those nurses are now teaching in nursing colleges around Kenya. So we were able to identify that, and we were going to use them as faculty and mentors. So we had 4 nurses that were doing that.
So you were able to prep more mid-career nurses who were experienced in palliative care with these more experienced nurses as mentors for the program.
Mm-hmm.
And in the first year of the program, what were the nurses? You said they were really working on palliative care and curriculum development. Tell me more about how that went. Like, what exactly were they doing day to day? Did they have to completely be off work to take the program, or how was it?
No, they did get permission from their hospital administration to be in the 1-year program, but we didn't require them to come in person for intensive training. So we offered regular calls that we explained the program and identified some of the needs and the wants of the nurses of what they were hoping to do through this program. And we realized that many of them are often asked to speak at their hospital or to run workshops or trainings about what palliative care is. They often have to teach healthcare providers as well as community members and sometimes even caregivers. So as the program continued, we planned for an in-person workshop where we were able to finalize some of the training material and curriculum that the nurses were going to use back in their workplace. We gave them a kind of basic skeleton of a curriculum of what basic palliative care content could be. But then we made sure that everyone had a chance to look it over, to adjust some of the images so that it was relevant to our East African context and include things that were really important for them. And we did that in an in-person workshop in Nairobi.
And then in the second half of the year, they took that curriculum and what did they do with it?
Yeah, at the end of that in-person workshop, we actually got all the nurses to practice, and we were all kind of watching them and judging them in the sense to give really positive and constructive feedback. So they were confident to go back to their workplace. So they were given a small template to create a budget for a workshop in their workplace. So we didn't have a lot of stipulations. It was a one-page template where they had to describe what the content was going to be, how many people were going to be there. They had to put forward a small budget of how much it would cost to rent a room and do some of their printing for the sessions. And then as the leadership of the program, we kind of assessed it and everyone was given what they were asked, which was really great. There was a lot of momentum as everyone was heading out to their workshops in person in their own settings across Kenya.
And they completed those workshops during the year?
Yeah, we had a chance for each nurse mentor. So the nurse faculty were paired up with a palliative care nurse leader that was in the program. So 2 leaders to 1 mentor, and each mentor had the chance to be at a workshop. So we had some funding for transportation, and it was really a very positive experience to have someone who was part of the program to physically be there with them as they were presenting. And the feedback was very positive of those sessions.
And then you said the program went beyond the 1 year. So what did you do going forward as the program evolved in the second year?
I think there was a lot of momentum from the nurses and there was interest. They not only had a small bit of funding to run a training, but now they had access to some curriculum that they worked on. So they also had some pride in working on that. And we realized that there was the program in general was lacking a little bit in terms of more formalized leadership training. And I think when we think of an average nurse in Kenya or in our region, access to leadership training in the general nursing program is limited. So we looked around, we looked at different textbooks and different opportunities, possibly to do the training ourselves as an association. But we realized that there was already some really good content available that was accessible to our group.
How did you fund all of this work? I know you mentioned the Hospice Care Kenya, but beyond that, were there other funders and supporters?
So going into the second year was a little bit challenging. We had this idea, and because they were a donor from the previous year, Hospice Care Kenya, they seemed quite interested to fund a second year. We kind of put it in the proposal that kind of a regional expert called Africa Management Institute was offering a program that we were really thinking we couldn't replicate. So we thought if we could offer a scholarship program for our nurses, they could attend that session. But there was some limitations. The donor from the UK was only able to fund percentage, about 50% of the budget we had put together. And we continued in those first few months to see if there were others that were interested in finishing out the 2 years of the program. But unfortunately, we had a few people that we thought were going to be interested, but it ended up resulting in that we didn't have the full funding for the second year.
So you kind of limited the second year to just that Africa Management Institute portion, it sounded like.
Yeah, we were really hoping that we could kind of mirror the way the first year worked, where we brought people together to learn some new topics and give them time to practice and then for them to implement in their setting. And I think that I was quite disappointed, but we did find a way to continue to engage the nurses in the second year with some really strategic online workshops from experts in the field, specifically related to monitoring and evaluating palliative care programs and grant and proposal writing.
Amazing. So it sounds like a lot of topics that are often pretty neglected in our palliative care training. You know, we get a lot of focus on the actual content in palliative care, but you really thought more broadly, what do people need to be successful? How well was this program accepted? Did you have any resistance from any groups, and how did you manage that?
The program was quite competitive within the first year, and I think there was some just personal disappointment that we couldn't enroll more nurses in the program. And then because the first year went so well, we were quite committed to the nurses we had already invested in. So I think that in general, if we thought about resistance, I would say just the depth and number of nurses we were able to invest in.
So what advice would you have for other programs if they were thinking, you know, this sounds like a topic and an idea that's really needed across the world as programs are starting to develop?
I think it's really important to identify the uniqueness of being a nurse. And I think that as we try to promote better access to palliative care around the world, especially in low and middle income countries. Nurses leading other nurses is going to be key. And we know that in general, the role of the nurse has developed in many, many places, and access to higher levels of education. If you don't have a lot of resources, it's very difficult to move to the next level. And not every nurse needs to do that, but I think there does need to be focused interest in investment financially even, and through leadership opportunities like this to really find ways to promote nurses so they can lead their colleagues.
Definitely sounds like such an important thing. And I'm so glad you're bringing this really to the forefront. Can you tell me some of the stories about what the nurses that you mentored in the program did? Because I know that this really led to positive personal and organizational change for both of your mentees.
Yeah, I was involved with two nurses. One was working in the National Referral Hospital in Nairobi, and the second was working in more of a community-based setting. And I think from my experience being a mentor in the program, it showed me how important it is, even for personal relationships at this level. I have had the privilege of being able to learn some of this over my nursing career, of how to write grants and how to lead trainings and workshops. And I think having someone believe that I could do it well really made a difference. So I tried my best with the two mentee nurses to really understand where they were working, understand what they were passionate about, and be very aware and present when I was at their session, their teaching session that they did throughout their second year when they did their virtual training, just checking in and finding things that were working well. And as opportunities in Kenya kind of continue to come up every few months, there was something new. I would really encourage the two nurses that I was working with closely to take advantage of that. So whether it was a grant that had come up and, I offered to help them, or if it was a conference and an abstract opportunity. English is my first language, and I really wanted to encourage them to not feel nervous about writing an abstract, and I would help them and help edit, and really has been so positive.
And you talked about the grant writing, and that's always such a challenge for people in palliative care. We aren't really experienced in grant writing. You helped one of your mentees with that, and I understand they were very successful in finally getting a grant. Can you tell us more about how that was?
Yeah, I was able to help one of my colleagues, Leonard Kiprono. He works in the Kericho area and started a community-based organization 8 years ago called Oasis of Hope. And they have been running purely on the support of volunteers in their area and a few healthcare workers that were quite interested to do some home-based care and support for families that have been caring for people with life-limiting illnesses. And Leonard has quite the personality and is very energetic, yet nobody over the 8 years since he registered his organization in his local region had financially supported him. And I was really hearing the urgency in his voice, not wanting to kind of shut the CBO down, but really just continuing to persevere. And I think I learned from Leonard through the process that patience is really important, and passion. Even as Leonard continued slowly to do his work, he remained passionate. And as I encouraged him and we got together and we wrote and kind of reimagined what his proposal, which was rejected many times, could look like, finally, we found someone that would support us. And since that program has started, it began at the beginning of this year, 2023, it has changed. We were hoping to not only train healthcare workers, caregivers, and religious leaders. We did have to adjust it. And I think we prioritize caregivers and religious leaders. But it's really shown us that with the passion that somebody has and a mentor kind of filling in some of the gaps and really encouraging, they're finishing their program. They've been able to train 20 religious leaders in Kenya, his kind of county area, as well as 25 caregivers that are really doing on the ground palliative care work in this area. I'm really excited for them. They are going to hopefully continue the project and bring in some of the other things that they weren't able to do in the first year. And I think especially when you find a lot of people saying, no, this is not going to work, you can get really discouraged. So I found that this mentorship relationship, although I couldn't fully empathize with him because I haven't been working in his region for 8 years, I was able to find ways to really build into his strengths.
That's amazing. And seeing how this nurse leadership doesn't just impact those nurses, but then, 25 caregivers, 20 spiritual leaders have then been impacted further as a ripple effect. That's so exciting.
Mhm.
You actually did a similar leadership program that you developed in Bangladesh before the program that you're now running in Kenya. How did the benefits of that Bangladesh program, how did that transfer over to Kenya? How was there a linkage?
It was our first program actually in Bangladesh to talk specifically and really focus on nurses and them kind of leading palliative care in their regions. We did learn a lot from the program, yet there was several nurses that were quite involved even after that very intensive program on content development and training happened. And I think because there were nurses that kind of shone, and although we had hoped that a few more would kind of maintain relationships, we were able to use what those nurses had learned in the first program in Bangladesh and actually invite them to be peer-to-peer support for our Kenyan nurses. So we engaged them through virtual means. Of course, now we are all much more connected. And they were able to share things they learned about being a nurse and teaching. They were able to share what they learned about creating a workshop and identifying teaching tools and best ways to teach an adult. Some of these things we don't learn in nursing school. And I think we're often put into situations as nurses where you're expected to know how to teach well. And I think that's not fair. And I think the one thing that as we brought both nurses together, they were able to understand the situations that they found themselves in and really support one another. And I think that was really, really important.
You had goals for the program initially. And what are your goals now as the whole program has evolved?
Yeah, so we have stayed in touch with the nurse leaders, which is great, of course, with technology and WhatsApp groups. It's easy for us to stay connected because none of the nurses live in the same county. We had nurses from all over Kenya. So as different opportunities come up, as different grants, funding opportunities, as well as conferences come up, staying well connected and being authentic with these opportunities. We're not just posting them on a huge group saying anybody and everyone. It's still quite targeted. And yeah, we're really grateful. In November, we're having a national conference in Kenya focusing on palliative care, and the nurses that were part of this leadership program applied for their abstracts and we were able to support them and they were accepted. So we're really looking forward to hearing how the nurses present what they've learned and what they've done, and just seeing this kind of as a stepping stone, not the end. Presenting at a conference doesn't mean the end of the work, but it's been a really, really great way to see how even small ways investing in nurses and really capturing that passion along with the patients, I guess, being patient for the process to occur can really impact not only patients and families, but beyond.
So measuring outcomes is so important in palliative care. We always want to know the impact of what we're doing, but it can be really difficult. So what did you guys do to measure how well the program was working?
So during the first year, we shared with the nurse leaders that were enrolled in the program that doing even potentially something as simple as a pre and a post test when you run a workshop. We know workshops sometimes are not very long, but identifying specific things that you would like to teach and then teaching them and identifying if the participants possibly learn something new is really important. So we encourage each nurse to do that. We did it. So we asked the nurses to do a pre and post test when we all came together for our first workshop, and then we expected it of them. So we role modeled measuring satisfaction, the surveys that we did, and the knowledge tests that we did. And I think that was something that was important to do, as we expected them to do that when they got to their field placement. And then we measured the number of people that were improving, even after a short workshop, possible change in their knowledge about a topic. As I worked much more closely with the mentee that I had been working with and the new grant that they got, it was not even questioned whether pre and post tests were going to be part of workshops, and just allowing people to give feedback wasn't even a question. And how quickly that changed, because I think we've all been to many workshops where that's not really considered. So that was quite encouraging for us. In the second year, the Africa Management Institute, because it was a scholarship program and we were not responsible for a lot of monitoring and evaluating of that program, we actually learned a lot. That program is really essential. So they were monitoring a lot of things that we actually hadn't even considered. One of the really interesting increasing outcomes. And of course, for our program, it was a very positive outcome. I know there are also outcomes that aren't always positive, but they showed us that 30% of the participants that had enrolled in their management institute called Thrive at Work had showed that even a few months after had received either a promotion at work or had an increased rate in their pay. And I think many times when we measure outcomes, we are thinking of numbers of people attending sessions, number of people improving scores on quizzes or knowledge tests. But this really challenged us to measure not only the outcome of transfer of knowledge and changes of attitude, but actually has this impacted the nurses' ability to even provide for their own family, even, impact a greater number of people because of their job and their role. And we were really encouraged by that. And I think it's something we would love to share with more people.
That's fantastic. And thank you so much for being with us today, sharing all different things about your program. And it's really inspiring to hear the work that you've been able to accomplish.
Thanks for having me. And if anyone's interested in this information, please do reach out to us. I am based in Nairobi, Kenya. And of course, everyone is welcome to our national conference that's happening in the middle of November with Kenya Hospices of Palliative Care.
Thank you, Erin.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related suffering. To learn more or to donate, please visit twoworldscancer.ca.